Hi all, hope you're doing well this week. Just wanted to provide an update on quiz information as well as a quick review of last week. Last week we did human resources and talked a bit about the human resource function. I think I had mentioned in last week's video that this tends to be an area that a lot of people enjoy, human resources. Hopefully, if this is something you're interested in, you enjoyed the information from last week. Really the function of human resources within a healthcare organization is pretty obvious: recruitment, retention, workforce planning, those types of things. A very important function, and one that is you know, even more important given the shortages of certain types of employees in the healthcare setting. Some areas are experiencing nursing shortages, not all, but many areas across the country are. Also, shortages of primary care physicians. In some areas, like for example in long-term care, I know there are some shortages of certified medical assistants to help in those settings, etc. It's challenging to work in human resources and healthcare currently because of the need for these employees, and there just aren't folks available in many cases. We also talked about employee retention, burnout. The notion of employee retention and burnout overall is a huge issue in healthcare. We talk about, throughout our course, we talked about it a little bit already, the triple aim. So the triple aim is about improving the quality of care at the bedside, decreasing the cost of care, and improving the health of the population. So those are kind of the three elements of the triple aim from the Institute of Healthcare Improvement. However, many in the industry have added a fourth element of kind of taking a recorrection of route for employees. So having joy in work, or decreasing worker burnout, decreasing clinician and clinical staff burnout. You may hear it referred to, and throughout the program we'll also refer to it as the quadruple aim. That fourth aim is really about reducing worker burnout in the healthcare setting. It's very stressful work, and people do get burned out. It's just an unfortunate element of our chosen area, and clinical folks get burned out, but administrators get burned out as well. It's an important thing to consider. So what else did we have last week? We had group case study assignment last week. Please make sure, if you haven't already, that you submit your self-and-peer assessment. If you submitted it to the classroom, directly to the classroom, that's great. If you did not submit it directly to the classroom, that is okay as well, if you email that to me. But I do need all of those in order to grade those assignments. So let's talk about the quiz questions. I've got 4 of them, I think, to go over here. So we'll just talk about these briefly. First one: human resources staff use of third-party websites can assist in. And so the correct answer was recruitment. So there's recruitment, retention, recruitment and retention, none of the above, or employee performance appraisals. So think about what we're talking about here. We're talking about a third-party website, and the main use of these in the healthcare setting is really to recruit, across anything actually from a human resources perspective, is really to recruit employees. So think of something like Indeed.com or Monster.com. I don't even know if that still exists, but those types of websites, it's all about recruitment. It's not the most frequently chosen answer other than recruitment was recruitment and retention. And we're not really going to use a third-party website to retain employees. Hopefully, we may have resources that we use to retain our employees, and we may use software in some way, maybe e-learning modules or something like that. But it's not necessarily going to be a third-party website. So those third-party websites are really important when we're talking about recruitment, so that we can reach those people that don't already work for us and hopefully get them interested in coming to work for us. Next question, major federal law affecting human resources primarily addresses, actually all of the ones that are mentioned here are things that are addressed in federal law. So protections for applicants and rights of employees, that is one area. Safety of the workplace, certainly another area, the OSHA laws and regulations, and accommodations for people with disabilities, that's the ADA, Americans with Disabilities Act, also very important federal law that affects human resources. So the answer in this case was all of these are correct, or all of the above. Next question. Which of the following is an example of a workforce planning and recruitment function? So several answers were provided. The correct answer was advertising for employees, which would be a recruitment function. We're talking about workforce planning and recruitment. So planning is going to be about determining what types of folks we need to hire, and then recruitment is obviously going out and hiring those folks. The other answers that were given were offering training and development. That's not really going to be a workforce planning or recruitment function, because we're not going to offer training and development to people that don't work for us quite yet. Assessing employee performance, again, that's if people are working for us already, then we would be assessing employee performance. That might be considered a retention function, but it wouldn't be part of planning and recruitment. And then finally, managing compensation and benefits. Again, that's more of an internal function within human resources, or it could be perhaps seen as a retention function, but it's not part of that planning and recruitment. So those three were incorrect, but the correct was advertising for employees, which is most definitely part of recruitment. Final question. The low supply of some healthcare workers, for example nurses, has led to which of the following impacts on health service organizations? So the correct answer here was lower satisfaction for existing staff. So when you have, think about a nursing unit, for example, and perhaps that nursing unit normally has 3 nurses in addition to aides and other techs and other staff on the unit. But let's say there's normally 3 nurses on that unit, but because of the low supply of healthcare workers, maybe 1 nurse leaves and there's no one to take her place. So now they're down to 2 nurses. Well, because the amount of work hasn't decreased, but the actual workforce has decreased by 1/3, that those other 2 nurses that have remained have to split the work of that other person that is gone, that they can't replace. So it does result in lower satisfaction for staff that are still there. The answers that were also chosen were higher satisfaction for existing staff. So obviously that's not the case based on what we were just talking about. And then higher retention of existing staff. Now, one would think that perhaps because of the fact that organizations are unable to, are having shortages in some areas and are unable to bring employees on, that would result in higher retention of those that are still sticking around. However, because of the notion of the lower satisfaction, because people are not happy in their jobs, they're more likely to leave in a case of a short staffing situation. So it only is making the situation worse by creating lower retention rates overall in those cases. So that is the biggest impact, or one of the impacts of that low supply of healthcare workers in many situations, is to create that lower level of employee satisfaction or poor morale across the organization. So if you have any other questions on quiz questions, please just let me know. I'm happy to review that. But those were the 4 that were missed most frequently. So this week we're going to move on to talking about operations quality and process improvement. And again, you're just getting a touch of this here. You'll learn more in either 2350, 2300, or 2350 if you're in the minor. And if you are an HSA major, you'll learn a great deal more in the class that we have on this topic. So this tends to be a popular topic with students as well. They enjoy the quality improvement piece. So this week we have that quality improvement piece. We do not have a discussion board this week. So don't be confused by that. It doesn't exist. But we have the written assignment, the quiz, and the Edpuzzle for this week. So if there are any other questions, please just let me know. But otherwise, I will look forward to speaking with everyone throughout the week. Thanks so much.